Hi there, everyone. My name is Alyssa Arnott. I am the Harm Reduction Coordinator with Sioux Lookout First Nations Health Authority. In this video, we're going to go over what toxic drug poisoning is and how to respond to it using naloxone. So thank you for taking the time to watch this naloxone training video, and with that, we can get right into it. Beginning with our land acknowledgement. Tikanagan Child and Family Services and the Sioux Lookout First Nations Health Authority are located on the traditional territory of the Lac Seul First Nation, signatory of Treaty 3. So looking at our learning objectives for this training, our primary objective is that participants understand the essentials of toxic drug poisoning and when and how to administer naloxone effectively. After this training session, you should have a pretty good idea of what opioids are, reasons why people may become addicted, have an idea of what toxic drug poisoning means, as well as knowing the signs and symptoms of toxic drug poisoning, knowing about naloxone, so this includes what it is, how it works, and getting comfortable with the contents inside your naloxone kit. We're also going to learn about how to respond to toxic drug poisoning, and this includes aftercare. So this is aftercare for the individual as well as aftercare for yourself. And lastly, knowing about the Good Samaritan Act and how it provides legal protection for those involved and responding to toxic drug poisoning. So we'll jump right in here to part 1, which is opioid use and routes to addiction. So what exactly are opioids and what leads to addiction? Opioids are highly addictive drugs with pain-relieving properties that are primarily used and prescribed for pain management. Opioids can also induce euphoria, which is that feeling of being high, so there's a greater potential for misuse or abuse of them. Some common types of opioids include codeine, fentanyl, heroin, morphine, hydrocodone, hydromorphone, and Demerol. So how are opioids used for pain management? What they do is they'll bind to receptors in the brain that reduce the brain's ability to receive pain signals from the rest of the body. They also have the potential to reduce emotional pain due to the euphoric effects that we discussed. As for some dangers and risks associated with opioid use, opioids are highly addictive, and this is because they activate these powerful reward centers in our brain, making us feel really good. However, they may cause respiratory depression, which is when one's breathing decreases to a point that they're no longer getting enough oxygen to maintain bodily functions. And it could slow down so much that breathing stops entirely. So why do we use opioids to treat opioid addiction? Using opioids like Suboxone and methadone to treat opioid addiction is a harm reduction approach that does not push abstinence, but rather emphasizes meeting people where they're at. This method of treatment is called opioid agonist therapy. Suboxone and methadone are controlled and regulated, meaning we know exactly what is in each dose. This decreases the risks associated with using unregulated, also known as street drugs, where the exact contents are not known. Suboxone and methadone clinics also provide the potential to form meaningful relationships and may provide routes to additional support services. Now that we have a better understanding of what opioids are and how they work in the brain, we can look into some possible root causes of addiction. Firstly, looking at mental health. Untreated mental illness, whether it be from childhood or in adulthood, may leave one with feelings of helplessness, pain, or a sense of being overwhelmed. Using substances like opioids could act as an escape from these negative feelings and/or thoughts. There's also trauma, which is experiencing stressful, frightening, or distressing events. This could include intergenerational trauma, which is trauma that is passed down through generations. For example, from grandparent to parent, and then to their children. So events that took place such as the 60s scoop and the residential school system leave behind these long-lasting traumas referred to as intergenerational trauma. There's also adverse childhood experiences, commonly referred to as ACEs. This could be abuse, neglect, or traumatization in the family, all during childhood, and may later present as criminal activity, family violence, substance use, and caregiver separation. It's important to note that addiction stemming from trauma is usually a way to try and return to a feeling of normal and a means to escape the possible PTSD and/or long-lasting negative symptoms caused by trauma. We also have to consider invisible disabilities, which are disabilities that cannot be seen and are not accommodated. So this ties back to mental health as well as things like genetics. So some research indicates that people who experience addiction may be genetically predisposed. And lastly, there just might be no identifiable root causes, and not everyone who has experienced difficulty or challenges in life will experience addiction. So the next part of this presentation here is going to be a short video by Gabor Maté, where he's going to go over how trauma is connected to addiction and how we can help to heal that pathway through connection.
So an addiction is a complex psychological, physiological process, but which manifests in any behavior that a person enjoys, finds relief in, and therefore craves in the short term, but suffers negative consequences in the long term and doesn't give up despite the negative consequences. So craving pleasure, relief in the short term, negative consequences in the long term, inability to give it up. Now, notice I has said nothing about substances. I said any behavior. So it could be related to cocaine, crystal meth, heroin, fentanyl, marijuana, nicotine, alcohol, whatever. Could also be sex, gambling, internet, relationships, shopping, eating, work, extreme sports, working out, pornography, any number of human activities. So I said any behavior. Now, the official definition of addiction, according to the American Society for Addiction Medicine, is that this is it's a primary brain disorder. It arises in the brain, largely due to genetic reasons. This is how they see it. And I say that's just not true. The other popular idea about addiction is that it's a choice that somebody makes, that people choose to be addicted, which is what the legal system is based on. Because if people are not choosing, what are we punishing them for? And although I think the medical definition is closer to the truth, I don't see it as it's a genetic disorder, and I don't see it as a primary brain disorder. So let me perhaps show you why, if that's okay. A human being has two fundamental needs, apart from the physical needs, in infancy, in childhood. One is for attachment. Now, attachment is the closeness and proximity with another human being for the sake of being looked after, or for the sake of looking after the other. Now, human beings, as mammals, and even birds, are creatures of attachment. We have to connect and attach because otherwise we don't survive. If there's nobody that's motivated to take care of us, to attach to us that way, and if not motivated to attach to others, we just can't survive. One interesting thing is that the endorphins, which are the body's internal opiate chemicals, which heroin and all the other opiates resemble, they help to facilitate attachment. So if you take infant mice and you knock out their endorphin receptors so they don't have endorphin opiate activity in their brain, they won't cry for help and separate from their mothers, which would mean that they would die in the wild. And which goes back to what happens in childhood when there's stress and trauma, these endorphin systems don't develop. And then when people do heroin, it feels like a warm, soft hug to them. They feel love and connection for the first time. That's why it's so powerful. But so we have this need for attachment, without which obviously the human infant, who is the most helpless, the most dependent, the least mature of any creature in the universe at birth, cannot survive without the attachment. And that attachment relationship, given that we have the longest period of development of any creature, well into adolescence and beyond, attachment is not a negotiable need. But we have another need, which is authenticity. Now, authenticity, auto the self, means being connected to ourselves, just knowing what we feel and being able to act on it. So that means our gut feelings. So let's look at how human beings evolved. For hundreds of thousands of years, and for 100,000 years or so of this species existing on Earth, how did we live? We didn't live in cities and houses and so on. We lived out there in the wild until very recently in human existence. Now, just how long do you survive in the wild if you're not connected to your gut feelings? Not very long. If you start using your intellect instead of your gut feelings, you just don't survive. So that's a powerful survival need as well. So attachment is a survival need. Authenticity is a survival need. But what happens if your authenticity threatens your attachment relationships? For example, as a 2-year-old, you get angry because you didn't get that cookie before dinner. But your parents can't handle anger because they grew up in homes when there was rageaholicism and they're terrified at the very expression of anger. So they give you the message that good little kids don't get angry. The message you receive is not that good little kids don't get angry, but that angry little kids don't get loved. Because your parents are now sullen, they won't look at you, they talk to you in a harsh way, you're not getting loved. Not experiencing love at that moment. Now, but you got to stay attached. Guess what you're going to suppress? The authenticity every time. And this is how we lose connection to ourselves and to our gut feelings. So that, strangely enough, that very dynamic, which is essential for human survival in a natural setting, not becomes a threat to our survival in this more modern setting, where to stay authentic is to threaten attachment. And so we give up our authenticity, and then we wonder who the hell we are, and whose life is this, and who's experiencing all this, and this life doesn't, and who am I really? And so that's where the reconnection has to happen. That's where the healing happens, is with that reconnection. But it's because of that conflict, that tragic conflict in childhood between authenticity and attachment that most of us face, that we lose ourselves and lose connection to our gut feelings. Now, this leads to the question of trauma, because it's one thing to recognize that all this originates in childhood pain. It's quite another to transform that pain. And for that, we have to understand what trauma is. So people often think that trauma is what happens to you. So trauma is a divorce when you were small and your parents fighting. Trauma is your mother's depression. Trauma is your father's alcoholism. Trauma is your parents' argumentation. Trauma is physical or sexual abuse or some loss. Those aren't the traumas. Those are traumatic. But the trauma is not what happens to you. The trauma is what happens inside you. And as a result of these traumatic events, what happens inside you is you get disconnected from your emotions, and you're disconnected from your body, and you have difficulty being in the present moment, and you develop a negative view of your world, and a negative view of yourself, and a defensive view of other people. And these perspectives keep showing up in your life in the present. So in other words, the addiction is not the primary problem. It's an attempt to solve a problem. And then the real question is, how did the problem arise? In other words, this is where my theory is that it's always rooted in childhood trauma, and that the addiction is an attempt to deal with the effects of childhood trauma, which it does temporarily, while it creates even more problems in the long term. And so the issue is not just to recognize what happened 10, 15, 30, however many years ago, but to actually recognize the manifestations in the present moment and to transcend them. And how do you do that? By reconnecting with yourself, by restoring the connection with your body primarily and with your emotions that you lost. And once you do, when you found these things again, then you have what we call recovery. Because what does it mean to recover something? It means to find it again. So what is it that people find when they recover? They find themselves. And the loss of self is the essence of trauma. So the real purpose of addiction treatment, mental health treatment, any kind of healing is reconnection.
So we've been speaking here a lot about addiction. However, it is important to know that you do not have to be addicted to opioids to experience toxic drug poisoning. As we can see from this diagram here, substance use does not equal addiction. It's important to note that this spectrum is not a linear progression, meaning that an individual's relationship with substances does not necessarily move towards being problematic. In fact, problematic use is rare, and people's relationship with substances can change over their lifetime and in response to life circumstances, just like people's relationships with other behaviors, such as exercise. Anyone who uses substances, regardless of where they fall on this spectrum, is at risk of experiencing toxic drug poisoning. Now we will be moving to learning a bit more about toxic drug poisoning, which is typically referred to as overdose or OD. Now, the reason we're moving towards this language of saying toxic drug poisoning as opposed to overdose is that when we say someone has overdosed, it insinuates that they have done something wrong, whether intentional or not, by using too much of a drug. However, the issue is not a matter of individuals taking an increased or larger dose, but rather it is an increase in the toxicity of the drug circulating. We're stepping away from calling it overdose in order to emphasize that the issue lies in the toxicity of the drug itself as opposed to being an increase in substance use. What is toxic drug poisoning? Toxic drug poisoning occurs when the drug overwhelms the body, and this leaves the brain unable to control basic life functions such as breathing, heart rate, and temperature control. As discussed, anyone exposed to opioids can experience toxic drug poisoning. This includes emergency responders, long-time users, elderly people, and young people. There are high-risk situations, so people who have been incarcerated, hospitalized, or in treatment are at the highest risk for toxic drug poisoning during their first 2 weeks following their release. Now, this is due to them not having access to the drugs or the same strength of drugs at the time that they were in treatment. There's also polysubstance use, which is when people use more than one substance at a time. This puts people at a higher risk of toxic drug poisoning because it can further enhance the effects the substance has on the central nervous system and one's body. We also have to consider individual physical characteristics. So things like weight, height, tolerance of the drug at the time, route of administration, or frequency of use can affect one's likelihood of experiencing toxic drug poisoning. And most importantly, there is no way to know, so you can't know how much of a certain drug or a combination of drugs will lead to toxic drug poisoning. This image here represents 3 vials of opioids, one containing heroin, one fentanyl, and one carfentanil. Now for reference, carfentanil is a very potent opioid used to anesthetize large animals such as elephants, so certainly not safe for human consumption. This image represents the quantity of the drug needed to achieve the same effect. So within each vial, each dose will achieve the same effect. This is why language is so important, because the issue is not a matter of overuse or that there are simply more drugs circulating. What we're seeing is an increase in the toxic drug supply. And with this, we have to consider prohibition, which is the act of forbidding something, including drugs. The issue with this is that when we prohibit drugs, they do not just go away. They simply become unregulated. And when the supply is unregulated, we see an increase in the potency of substances circulating. For example, we can consider the prohibition of alcohol. So prior to the prohibition of alcohol, the most popular alcoholic beverages included beer and wine. During the prohibition, this changed to rum and moonshine, which have a much higher percentage of alcohol and therefore much more potent. And we're seeing the same thing with the current drug supply. So as we can see, an extremely small amount of carfentanil being included in heroin is likely to nearly double your dose, making it far more toxic for consumption. Now that we have a better understanding of what opioids are and what toxic drug poisoning is, we can now move on to how to recognize the signs and symptoms of a toxic drug poisoning. The signs and symptoms of toxic drug poisoning vary depending on the substance used. For this purpose, we're going to focus specifically on opioids. So recognizing a toxic drug poisoning on opioids may look like small pupils, which are otherwise known as pinpoint pupils. Now, this is going to be the telltale sign that the poisoning is most likely a result of opioids, as toxic drug poisoning from other drugs such as stimulants and hallucinogens will result in large dilated pupils. Other signs include nails and lips becoming blue or purple. This is due to a limited oxygen supply. You may hear deep snoring or gurgling sounds, and their heart rate or breathing may slow down or stop entirely. Some other signs could include feeling drowsy, falling asleep, limp body, vomiting, loss of consciousness, and pale, cold, or clammy skin. With all the information we just learned, we can now look at what naloxone is and how to use it to respond to a toxic drug poisoning. What is naloxone? Naloxone is also known as Narcan, and it is a medication with life-saving potential that temporarily reverses toxic drug poisoning. But it only works to reverse the impacts of opioids, so it will not work for other drugs like stimulants or hallucinogens. So how exactly does it work? What it does is it attaches to the same receptors in the brain that opioids do, but it attaches more effectively and temporarily removes the opioids and their harmful effects. Now, it is only effective with opioids. It will not reverse the impact of other drugs such as cocaine, LSD, Tylenol, or crack. However, it is safe to give even if you're not sure what substances have been taken. And it's important to know it only temporarily reverses the effects of opioids. It'll start to work in about 1 to 5 minutes and will remain active in the body anywhere from 15 to 90 minutes. Now, it does not destroy the opioids, so those opioids are still in your brain, just not attached to the receptors. So once the naloxone wears off in 15 to 90 minutes, the opioids can return and rebind to those receptors, meaning toxic drug poisoning can still reoccur. So this is why it's important to note that naloxone does not replace medical care. The individual will still need to go to the hospital or nursing station or call 911 if available in your area. Now, this is because those opioids, as we said, are not destroyed and may rebind to those receptors. If you're taking this training, you should have a naloxone kit in front of you. You can go ahead and open that up and we can get a bit more comfortable with the contents inside your kit. When you open it up, you're going to see 2 naloxone hydrochloride sprays. These are the medications. You're also going to see a 5 steps to save a life pamphlet, a patient identifier card, gloves, and a rescue breathing barrier. Now that we've learned what naloxone is and how to recognize toxic drug poisoning, we can dive into how to respond to toxic drug poisoning using the 5 steps to save a life. We're now going to proceed with taking a deeper look into the 5 steps to save a life and what exactly is included in each step. Starting with step 1, this is shake and shout, and this is where we're trying to see if the individual can be woken up. You'll start by assessing the scene to make sure it's safe to approach and put on your gloves. Once you've determined the scene is safe and your gloves are on, you'll begin by calling the individual's name, if you know it, and shaking their shoulders a bit, making sure not to shake too hard or cause any bodily harm. And make sure you're not putting your hands in any pockets or bags where there could be potential sharps or other hazards. Now, once you've determined the individual is most likely experiencing toxic drug poisoning, is unconscious, or not breathing, we can move on to step 2. Step 2 is giving the naloxone, which we will now walk through step by step. Before administering the naloxone, make sure the individual is laying on their back and proceed with opening the package. To do so, you're going to peel back the corner with the circle on it and remove the medication from the packaging. To hold the spray, you're going to place both fingers on either side of the nozzle with your thumb on the plunger. This is going to make it easy to press the plunger and administer the medication. Once you're ready to administer the naloxone, you're going to tilt the individual's head back, supporting their neck with your hand, and gently insert the nozzle into one nostril until your fingers make contact with their nose. Once in place, press firmly on the plunger to release the medication like so. Now that the naloxone has been administered, step 3 is going to be contacting emergency services. This could be your local hospital, nursing station, or 911 if available. Make sure you quiet down the scene and speak clearly and calmly, telling the first responders that the person is not responding to stimulation and that you have administered naloxone. Let them know where you are. If indoors, ensure the door is unlocked, and if outdoors, try and give the nearest landmark. If possible, get someone else to wait for the first responders while you wait with the individual. Now that you've administered the naloxone and called for help, step 4 is going to be chest compressions or full CPR if needed. Firstly, you'll want to check if the individual is breathing by tilting their chin up to open their airway, leaning your cheek over their face and feeling for breath while watching for the rise and fall of the chest. Now, if you've determined that the individual is not breathing and you're comfortable to do so, you would begin chest compressions or full CPR if trained to do so. To find the center of the chest, run your fingers along the bottom of their rib cage until you find the center point. Place the palm of your hand here on their chest, clasping your other hand over top like so. Lock your elbows and begin pushing hard and fast in the center of the chest, making sure you're letting the chest fully rise between each compression. If comfortable, you can also provide rescue breathing using the breathing barrier provided in your naloxone kit. You're going to do this at a rate of 30 compressions to every 2 breaths and repeat until medical help arrives or the individual wakes up. If possible, switch persons doing compressions every 2 minutes to avoid fatigue. Step 5 is where we want to assess, is it working? If the person has not started breathing on their own within 2 minutes, or the person becomes unconscious again, give a second dose of naloxone and continue chest compressions until medical help arrives. If administering a second dose of naloxone, try to administer it in the opposite nostril as the first one, as this will increase the absorption through the mucous membrane and the effectiveness of the naloxone. If at any point you need to leave the individual alone, place them in the recovery position. Placing a person in the recovery position helps to prevent the person from choking on their vomit and prevents their tongue from blocking their airway. Bending their knee forward will help to prevent them from rolling onto their stomach, and having their head tilted slightly back will keep their airway open. What happens when naloxone starts to work? It'll be different for everybody, but it could look like waking up suddenly, waking up slowly, being disoriented, wanting to use more drugs, being agitated or aggressive, or potential withdrawal symptoms. These withdrawal symptoms could include agitation, anxiety, muscle aches, sweating, nausea, and vomiting. However, once the naloxone wears off, these symptoms do tend to get better. It's important to note that once naloxone wears off, the person may still experience toxic drug poisoning. As we discussed, naloxone only removes the opioids from the receptors, but does not destroy them. So once it wears off, those opioids have the opportunity to reattach to the receptors. Now, a half-life is the time it takes for the amount of a drug's active substance in your body to reduce by half. Opioids tend to have a much higher half-life than naloxone, with naloxone staying active anywhere from 15 to 90 minutes, and some opioids lasting longer than 12 hours. We're now going to look at aftercare, which includes caring for both yourself and others after responding to a toxic drug poisoning. Starting with aftercare for the individual. When the person becomes responsive, make sure to be kind and patient. Speak calmly to them, telling them exactly what has happened and letting them know you administered naloxone and that it will wear off in about 15 to 90 minutes. Provide comfort measures, use harm reduction strategies to support safer substance use, and help with their mental, emotional, spiritual, and cultural wellness if the individual is receptive to this. And most importantly, we want to work on creating an overdose response plan. This could include letting someone know when you'll be using with someone you trust, informing family or friends where you keep your naloxone kit, and ensuring your kit is nearby when using. When using with friends, use one at a time so someone is able to administer naloxone and get help if needed. We all have a responsibility to protect the sacred breath of life, and a medication like naloxone has the life-saving potential to do so. Now we also have to consider aftercare for the responder. Not only living through, but also responding to toxic drug poisoning can be a difficult and traumatic experience. We're going to want to make sure we have policies in place for toxic drug poisoning prevention, recognition, and response that include debriefing and staff supports. Know that self-care does not replace community care. Make sure to give yourself the kindness and compassion that you're showing to others. Talk with your friends and/or family, a healthcare provider or counselor, or talk to your local opioid overdose prevention community contacts. This is also a good time to get in touch with the harm reduction team at Sioux Lookout First Nations Health Authority or your local naloxone distributor to have your naloxone kit refilled. Next, we're going to take a look at the Good Samaritan Act, which provides legal protection to those experiencing or responding to toxic drug poisoning. The Good Samaritan Drug Overdose Act provides legal protection to those who experience or witness toxic drug poisoning, anyone seeking emergency support, whether they stay or leave before support arrives, charges for possession. So if there are worries about calling because the individual has drugs on them, they will be legally protected under this act. It also protects those with breaches of conditions, which could be during parole, pretrial release, probation orders, simple possession, or conditional sentences. However, it will not protect against more serious offenses such as outstanding warrants, production and trafficking of controlled substances, and all other crimes not outlined within the Act. And lastly, the following are some frequently asked questions that we've been asked throughout our training sessions that might help to answer any questions you may have. Firstly, does the person have to be breathing for naloxone to work? No, the medication is absorbed through the mucous membranes in the nasal passageway and goes directly to the brain regardless of if the person is breathing or not. What if a child takes naloxone? We recommend treating naloxone like any other medication, so you should ensure it is out of reach of young kids. However, if a child does gain access and administers a dose to themselves, it will not cause any harm, but you should still check in with a medical professional right away to ensure that naloxone is the only medication they took and that there has been no further harm. Will naloxone work for any other drug? No, naloxone is only effective for reversing the effects of opioids. Sometimes other drugs such as cocaine are cut with opiates to increase potency and their addictive potential. In this case, naloxone would work to reduce the impacts of the opioids, but not the cocaine. It will never be harmful to give naloxone if you are unsure of exactly which drugs were taken. Why are there two doses? This is because naloxone only lasts about 15 to 90 minutes and may wear off by the time help arrives, or may not work with just a single dose. The second dose is there in the event that the first one wears off or did not work immediately. Can I leave my naloxone kit in my car? We recommend storing your naloxone in a cool, dark place away from any direct light or extreme temperatures. And in northwestern Ontario, we know how cold and hot the weather can get. It should be treated just as you treat any other medication, as extreme heat may decrease the effectiveness. And what happens if it freezes? So naloxone can still be given after it's been frozen. However, it will need to thaw prior to using. Try to make sure your kit is stored at room temperature so that it's ready to be administered when needed. Can I use more than 2 doses? Absolutely. You can administer as many doses as you have available if the person does not regain consciousness or begin breathing on their own. Can I use expired naloxone? We recommend getting replacement medication as soon as you realize your naloxone is expired. However, if the only thing you have on hand is an expired dose, administering it could still be effective. Naloxone is likely to still be effective beyond its expiry date and may still save a life. Can I administer both doses simultaneously? Considering naloxone only lasts about 15 to 90 minutes, we recommend saving the second dose in the event that the first one wears off. Giving both doses at the same time would increase the amount of naloxone in the system, but would not increase the duration of time that it remains active. And lastly, what are some other harm reduction services? This could include needle distribution programs, safe injection or consumption sites, drug checking services, and decriminalizing and destigmatizing substance use. Miigwech, thank you everyone for attending this training session. I hope you've been provided with the tools and knowledge you need to administer naloxone and that you feel comfortable to do so if needed. The end of this video will include a short list of contacts, including myself, as well as other staff that contributed to the creation of this presentation. Should you have any questions, please don't hesitate to reach out. Thank you.